Hello and welcome. My name is Sue Morris. I'm a clinical nurse educator here at the Horizon Health Network. I work for the New Brunswick Heart Center. And Horizon Health has started an AED initiative. And so we are hoping to roll this out anytime after June of 2019. So what is an AED initiative? So I'll provide you with a little bit of background. So for the past 20 years, resuscitation scientists have demonstrated that patient outcomes can be very, very significantly enhanced by bystander or early CPR, and that CPR needs to be of quality. So we have particular things that we will be using soon called feedback devices, and those will give the provider of CPR an indicator to say, am I going fast enough, deep enough, and at a particular rate? And so quality CPR has been well established as a standard of care, and early access to defibrillation has been demonstrated to save lives. And so what Area 2 has done is developed an AED program that is focusing on how quickly we can get defibrillation to a patient. And so we have put AEDs in a lot of high traffic areas and also some of those difficult to access areas within our facilities in Area 2. So the nice thing about the particular AED that we have chosen is it is superior to many AEDs that we've looked at for a couple of reasons. And the top priority for our committee was to ensure we had a CSA approved device, obviously. However, we needed it to transition well when our code team arrived. I want to do a quick demonstration of how easily it is to transition from the AED to the manual defibrillator that I am going to get. So here is my manual defibrillator. It has a patient therapy cable to it. And this cable is what we would normally attach our manual defibrillation pads to. However, we are hoping and really expecting that by the time the code team arrives, this AED will have delivered one or possibly two shocks, depending on how remotely located the victim is. And so I will do a quick demo here. Here is the carrying case. I'm going to open.
Adult mode. Remove all clothing from patient's chest.
So I have taken the shirt or garment and
pull red handle to reveal pads. Look at pictures on pads.
And if I needed to access a pair of scissors, I would turn the AED over, pull the black tab. I have an extra set of pads. I also have a razor, some gloves, and scissors in case I'm not able to access the patient's chest by pulling off the garment. So you may have to cut it. So I have taken that out of the back. Again, I'm going to turn on my device.
Adult mode. Remove all clothing from patient's chest.
So I've done that.
Pull red handle to reveal pads.
So
look at pictures on pads.
I'm going to pull.
Apply pads to bare skin exactly as shown in the pictures.
The red handle.
Press pads firmly.
that reveals my pads. I'm going to
Pull red handle to reveal pads. Look at pictures on pads.
Again,
Apply pads to bare skin exactly as shown in the pictures.
again, if this were on my patient, I would have to remove this and wipe any jelly, if the patient had a medication patch, anything here in the way. And so I am placing this electrode, the red one, above the right nipple. My second
Adult mode.
Second
Remove all
pad
clothing from patient's chest.
is lateral to the left nipple.
Pull red handle to reveal pads.
And because this is a
Look at
real
pictures on pads.
AED
Apply pads to bare
and
skin
not a trainer,
exactly as shown in the pictures. Press pads firmly.
and not a trainer, it does not recognize that it is on a dummy. It has to sense resistance in order for it to analyze. And so if this were applied to a patient or a person who was found unconscious, the machine will sense the patient's resistance, and it will say, "Do not touch patient," analyzing heart rhythm. And so the very first time it is applied, it will ask you to not touch the patient. Then it will say shock indicated or no shock advised. If it says no shock advised, then you will continue doing effective CPR. If it says shock advised, this machine will charge. And then it is the operator's responsibility to say, "I'm clear, you're clear, we're all clear. Nobody should be touching the victim." And the red button will be flashing. You will deliver the shock. And so you're continuing to do CPR, and the code team
Adult mode.
has arrived.
Remove.
And so I have removed these pads from the AED for demonstration purposes only. I'm going to apply them to my patient. Again, remember, if this were a real victim, this would have to be removed. My mannequin doesn't have that ability. I've got both of my pads on my patient. The nurse or the person, first responder, has started CPR, they have applied the AED, and now the code team has arrived. This will be sitting in the AED. So just exactly like this. I have taken it out for demonstration purposes. The code team is going to peel back this plastic and pull out this connector. They are going to take the patient therapy cable from their manual defibrillator, which is a LifePak 20. And so I'll just show you this LifePak 20. This is what is on all of the crash carts in Horizon Area 2. This is the patient therapy cable. And so when I attempt to push it in, it only goes in one way. But it friction fits very nicely in. Now, these pads will demonstrate the rhythm on my manual defibrillator. It is very important that the person who is operating the AED tell the code team how many shocks have been delivered, because that will determine where we set our energy for all successive shocks after that. So the location of these AEDs will be put on a map and distributed to all nursing units so that everybody in the facility is aware of where AEDs will be. The reason, one of the reasons why this particular brand was chosen is because it has trademarked something called CPR Insight. And Insight is a special component that allows, after the first shock has been delivered, we will do 2 minutes of uninterrupted CPR, unless we are interrupting for breaths, pardon me. But it will analyze through our CPR after the first shock. And so that buys the patient extra time on the chest, which we know translates into improved outcomes. So it has the ability, after the first shock, to analyze the heart rhythm while CPR is being done. And that's a very important feature. Another reason this was the device of choice is because of fleet maintenance. And what I mean by that is we have a number of these devices. It will prove to be rather difficult to manage expiry dates of pads, which are have an expiry date of 4 years, which is quite lovely, but also the battery life. And so our biomedical engineering department has the ability to access every device we have wirelessly to ensure that there is adequate battery life and that there are pads that are not expired. So to me, from a legal perspective, from a patient safety perspective, that is very important. There will be, the majority of these AEDs will be in cabinets. These cabinets just pull with the handle, and when they are opened, have a very loud alarm. Please be aware that this alarm does not activate a code blue in this facility. It's an alarm so that everybody is aware that the cabinet has been opened, but you still need to call 6666 to activate your code. So please remember that if this is a child, somebody 16 years of age and less, you're going to say code blue pediatrics. And what that will do, it will harness nursing manpower from the emergency department, but it will also act as a stimulus to get the locating or the telecommunications officer to call the pediatrician on call and page him or her stat so that the pediatrician can be present or at least aware of what is happening in a pediatric case. So very important, the cabinets are powered with an alarm. That alarm is to alert people in the surrounding areas that the AED has been accessed. It does not call a code. You need to call 6666. You can deactivate that alarm by closing the door of the cabinet. So if you take it out, close the door of the cabinet, and that will turn the alarm off. There are 2 modes to this AED. Adult mode, and that is the default, or child mode. So when it starts, it says adult mode, and its voice is quite loud. We have set the volume significant. And if you had a child, you would simply press the button, and there's a little child in the button icon, and it will switch from adult mode to child mode. The child is considered from age 0, so birth, to about puberty. And the Heart and Stroke Foundation defined puberty as underarm hair in men and breast tissue on females. That's a guide. If you feel that this is a very large child, very tall and maybe a bit robust, then you may opt to, as a healthcare provider, you may opt to go with the adult mode. Just know that you're not going to harm the child. American Heart Association and the Heart and Stroke Foundation of Canada have both suggested if you do not have a pediatric component to your AED, then you will use the adult pads in the young child or even an infant. And if they overlap, then you will do an anterior front to back pad placement. So the amount of joules in the adult, the first shock is at 200 joules. Then you provide 2 minutes of CPR. The second shock is at 300 joules, and then you provide 2 more minutes of CPR. The third shock and all successive shocks after that are delivered at 360 joules. If you were in the child mode, first shock is 50. 2 minutes of CPR, second shock is 75 joules, 2 minutes of CPR, and then all successive shocks after that are at 90 joules. There is a nice component to this, it's the CPR coach, and it will provide instructions. If you were in the adult mode, it will give adult instructions, and if you are in the pediatric mode, it provides pediatric instructions. It will give you feedback when no CPR is detected. So if you should be doing CPR, the device will say, "No CPR detected." And it's a very loud, robust voice. It will give you guidance for the rate and the depth. And it has a nice metronome that goes boing, 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 so that you can keep time to the metronome. And that is very, very helpful to try and focus the person doing the compressions. There is also instructions on hand placement. And so it will say, take the heel of one hand, place it in the center of the chest. Take the heel of your other hand and place it on top. Push down approximately 2 inches. Or it may say 5 centimeters. Reordering your pads. So the responsibility, once the code blue has been deactivated and you're getting back to normal life on your floor, it is the responsibility of the nursing unit to reorder the set of pads. And so on every AED, our biomedical engineering department has placed the SPD or the store's ordering number. And if this were an AED that was activated in a very public place, then our biomedical department will reorder. Replacing the pads. Replacing the pads is very easy. You will open the device. And so there are 2 tabs here in the bottom corners. I'm going to push in on one, push in on the other, and I am going to pull the pads down. This is recyclable, except for the pads. So I discard that, and I put my new set in. So let's say this is my new set. They would look in a better repair than this, but this would be my new set. It slides in at the top, slides in, and you just push it down, and it locks in place. Very easy to replace the pads. As I mentioned earlier, the back of the carrying case, so this will be inside of a cabinet. I pull my black tab and I can find an extra set of pads, a razor, a pair of scissors, and a set of gloves. Again, I'm going to reiterate how important it is for you as the basic life support provider. You have done this patient a huge service by getting on the chest as soon as you recognize that the victim is unconscious. And then you have applied the AED in a very, very expedited fashion. So when the code team arrives, you will be maybe into your second shock by then. And so when the code team arrives, I would like you to tell the team if this is an inpatient or an outpatient, a witnessed or an unwitnessed arrest. So if you walked in and you found a patient or a visitor on the ground, that's an unwitnessed arrest. But if you were with the patient or the visitor and you watched them go down, that is a witnessed arrest. I would also like you to convey the number of shocks that you have delivered as the basic life support team. So if one shock has been delivered, then the critical care emergency nurse will set the defibrillator no longer at 200, but he or she will go to 300 joules for the second shock. If 2 shocks have been delivered, then the nurse will go directly to 360 joules on the manual defibrillator, and all shocks after that will be at 360. There is a nice component to this, the data extraction component, where I know in my program, the New Brunswick Heart Center, oftentimes our electrophysiologist, Dr. Toll and Dr. Wong, will call our public access defibrillation coordinator, and they will ask her to download the data from public AEDs so that they can see what type of rhythm the patient was in. We will be able to do that with these AEDs, and we can do it through Wi-Fi, and it will be through our biomedical engineering department. So that is an excellent option. That brings us to the end of this video. If you have any questions, concerns, or would like to discuss becoming a basic life support instructor, I encourage you to call or email me, susan.morris@horizonnb.ca, and I will put you in contact with the people who can answer your questions appropriately. I thank you for your time and have a great day.